Good morning, everyone. Today I'm going to be talking about survivorship in oncology, the impacts on the individual and family, management of loss, and psychosocial practice in head and neck cancer. This was a recent essay that I completed for my studies in cancer science, and I found it a really interesting topic, so I thought I'd share it with you. So I hope you enjoy. Okay, so survivorship is becoming an increasingly important part of treatment in the field of oncology and cancer care, and as a result is becoming more recognised in the treatment and management of cancer. Survivorship is more common today than it was a century ago. However, a disease-free health status does not always equate to adequate psychosocial and physical health and can lead to more complex and concerning issues associated with cancer treatment cancer after treatment has ceased. Um, And as you can see, this is a quote by William Shakespeare, and I found this particularly fitting for the presentation. Okay, so as cancer research advances, prevention, treatment, and survival rate also increase. This can result in different psychosocial issues occurring months or even years following the completion of treatment. The transition from cancer patient to cancer survivor is a psychosocially significant and can increase fear of reoccurrence. The unknown and a feeling of abandonment despite being cancer free. So once the patient transitions to cancer survivor in their cancer journey, there can be a number of different psychosocial issues that can impact on the individual as well as the family or caregivers. These can include family relationships and role changing, communication, financial stress, employment, discrimination, fear of recurrence, loss of identity, loss of relationships, self-image, depression and anxiety. Family relationships are affected. Family members can often be described as secondary survivors and can be faced with unique psychosocial issues. Family members must adapt to the changes that can occur as a result of cancer treatment. For example, changing roles, ongoing care needs, changing financial roles. The concerns and issues of the family members or caregivers can often mimic the concerns and issues of the cancer survivor. For example, family members may feel isolated, overwhelmed with the level of care the survivor requires, frustration, guilt and burnout. Often family members will be provided with second-hand medical information from the patient themselves or from other family members, and as a result can cause anxiety and concern in isolation about the future. It's not uncommon for the family member to question their actions or have feelings of guilt or resentment during this time. So moving on to head and neck cancers. Head and neck cancers have unique clinical and oncogenic characteristics and as such also have unique survivorship issues that can impact on quality of life. Head and neck cancer is arguably the most psychologically traumatic cancer experience, and given the importance that many head and neck cancer survivors place on the appearance of facial and neck structures and the visibility of the disease, and associated treatment modalities such as surgery, radiotherapy, there are many issues that can be identified and impact on quality of life. As mentioned previously, survivorship is increasing and a large amount of head and neck cancer patients are now surviving, as with other cancer types as well. So head and neck cancer survivors face many issues with their survivorship, which are dependent on a number of clinical and non-clinical factors. such as T classification, location, stage of the cancer, organs affected, um, age, psycho, socioeconomic status, and rural versus urban location, and functional issues such as impacts on speech and swallowing, nutrition and breathing, particularly people who have laryngectomies, are often impacted or affected in head and neck cancer survivors um, and are unique to head and neck cancer treatment and management. All right, so this is another quote that I found quite fitting for the presentation. If you just take a moment to read it. This was taken from a book written in 1985 by a doctor who actually became a cancer survivor, and he explores the issues that the psychosocial issues that he found after cancer treatment. So, in conclusion, and our final thoughts, cancer survivorship is becoming an increasingly essential aspect of cancer care, and in particular, survivorship in head and neck cancer and the associated complexities of the disease and survivorship journey. So, this presentation kind of touched on the broad psychosocial issues with cancer survival, and it demonstrates some of the complexities of head and neck cancer survivorship and the psychosocial issues that follow the patient and the family and caregivers. And in particular the partner of the survivor. Head and neck cancer is a debilitating disease and arguably the most psychologically traumatic cancer due to the effects of treatment, visible disfigurement and effects upon essential functions such as swallowing, breathing and communication. The process of recovery post-treatment is complex and often involves many rehab specialists and ongoing support and therapy, sometimes for a number of years. There is greater need to increase support in psychosocial care in this area and to further develop clinical guidelines and models of care to support the patients and their families and the partners of survivors. Head and neck cancer is increasing globally and is an area of growth for the future. Therefore, it's really essential that we keep researching this area and developing clinical care guidelines with a psychosocial focus, and that the psychosocial care is made a priority and included in the treatment and management plan for these types of cancers. And here are my references, and if anyone would like to ask any questions or anything, I'm more than happy to answer them. Thank you very much.